record. So there we go. All right, so everyone is here today for the Count the Kicks webinar. We're specifically kind of focusing in on healthcare providers today. So I noticed that a lot of people said they're with Healthy Start or nurses with clinics, and we really appreciate you being here today and taking this information back. So we'd also like to thank the Florida Department of Health. Carolyn is here, she's our representative, and we really appreciate our partnership that has stood for several years now. We're very excited. We've recently had 2 baby saves that are Florida specific. And so we're excited to talk a little bit about that with you today, but very thankful for our partnership with Florida Department of Health. And we know that through the use of Count the Kicks program, when we compare this to metrics across Iowa, and this is what we're kind of holding up our campaign to, and I'll speak a little bit more to that in a little bit. We know that we could be instrumental in saving 491 babies just with the implementation of Count the Kicks across Florida. So just keeping that in mind today. And like I said, we're going to share with you a baby save story that happened, and we just got another one not that long ago. So very excited about the work that's happening here in Florida. So I am Sarah Coleman, and I am the State Expansion Director for Healthy Birthday. And I'm joined today by Sarah Hybels, and she, like I said, is going to monitor the chat for me and just keep an eye out for anything that you might need and have questions for. So again, we're really focusing in on healthcare providers, and I want to share a message with you from somebody who's instrumental in the program here in Iowa. So let me get this going.
Before I came to work at the health department, I was a labor and delivery nurse at one of the larger hospitals here in Iowa. So I know firsthand the impact that a stillbirth has on families, as well as the providers. And I have also seen the situations where the woman has monitored her baby's fetal movements and has come in because she's noticed a decrease in those movements, and that baby has been saved. So I know that it works, and I know that Count the Kicks make a difference in saving the lives of babies. I think anyone that takes care of a pregnant woman should be teaching her about how to monitor her baby's fetal movements. There was one time when a family had a stillbirth delivery, and as I was dressing that baby after it was born, I realized that that little boy was never going to ride a bike, and that that little boy was never going to go to school, and that the parents would never be able to watch their son graduate from school. And even though you try to be professional and a little bit detached just to make it through your day, you can't help but be affected and know how important it is to prevent these stillbirths from happening.
So again, that's Kim. She's here with us in the Iowa Department of Health and Human Services. Really grateful for her perspective as a nurse that how Count the Kicks can be instrumental as a campaign in preventing stillbirth. So here is just a little bit of numbers around stillbirth. This has recently been updated. You can see that we have had a trend that's had some up and downs through it with the changes. We also have some data that presents about some of the disparities that exist. And we know that the Florida population is diverse, and we know that stillbirth does occur across the state. So Florida loses an average of 1,534 babies a year to stillbirth. And if you look at this the trend line graph that's here, that teal line is the United States. The yellow line is the Iowa campaign, which I talked about at the very beginning, and the red line is Florida. And so what we're trying to do is have a replication of the work that happened in Iowa as we engage with providers across the state of Florida to get the word out about Count the Kicks, so that we can see that trend line continue to go lower. We want to prevent stillbirth. So what exactly is Count the Kicks? Maybe some of you have heard of it, but this is an evidence-based campaign, an educational campaign that provides empowerment for expectant parents. We're going to go through some of the evidence that's there, and we want you to recognize that within your practice, you have an opportunity to provide this education on why fetal movement is so important and what it can do to strengthen communication between a provider and parent if they're tracking that, so that they can speak up if they are noticing differences. This is one of our most recent baby saves out of Florida, baby Ashlyn, and she is so cute. We actually were notified about this by a provider. And so just having the word out about Count the Kicks is really important. And if you come across a baby save or an opportunity, we'd love for you to let us know so that we can share the faces of these babies that we've saved. And they're really the reason why we do what we do. So I'm pleased today to be able to provide this beautiful little face to you, the Florida Baby Save. I want to share a message with you now. Get this going. Another message from a provider.
Hi, I'm Ann Anderson Berry, the Medical Director of the Nebraska Perinatal Quality Improvement Collaborative and the Chief of Neonatology at Nebraska Medicine, UNMC, and Children's Hospital and Medical Center here in Omaha, Nebraska. It is my honor to serve on the Medical Advisory Board for Count the Kicks. Count the Kicks empowers women to learn how their babies move in utero and prevent still death. This is a profound opportunity to decrease stillbirths across the country. Thanks, Count the Kicks, for everything you do.
So appreciate those remarks from Dr. Berry. I would like to take this opportunity to get into some of the evidence behind our campaign before we tell you about the opportunity to order materials and get this really into your hands. So what we are founded upon is something called the Norway study. And you can see some bullets here about this study. This study occurred in Norway, and there was a population that was being surveyed. They were asked to take a look at the incidence of fetal movement monitoring. The researchers were looking at fetal movement monitoring. And what happened was as they looked at this research sample population, they noticed that the individuals who were tracking fetal movement monitoring, they saw a reduction in their stillbirth rate. And this was across that population. And so our founders, the 5 women who founded Healthy Birthday, the Count the Kicks campaign, saw this study and they decided that they wanted to replicate that here in Iowa. And you can see Dr. Ruth Fretz is circled on that slide. Dr. Fretz is actually on our medical advisory board now. And so we're really pleased to be able to lean into this, into her expertise and use this study. And when I give you some of the resources at the end of this presentation today, you will be able to click on this study in the slide if you'd like to take a little bit more deeper dive in that. And then we are also really pleased to be able to provide for you QR codes. We were recently published in the British Journal of Obstetrics and Gynecology and also the American Journal of Obstetrics and Gynecology. And so we have that research that's been published showing that our campaign really is evidence-based and effective. And brand new, we have a practice brief. We've recently had an opportunity to publish with AWHONN, and this sheds light on various aspects of fetal movement, emphasizing the need for education during pregnancy and interventions to ensure the health of both mom and baby. So these key components outlined in the brief, they align seamlessly with our prevention program called Count the Kicks. One of our researchers, the author of the British Journal of Obstetrics and Gynecology study is Dr. Hazel. And I'd like to share a message from him now about the importance of this campaign and what it means for him as a practitioner.
We know that there was no other sort of public health campaign going on in Iowa related to stillbirth at the time. And we know there's a relationship between the activity of Count the Kicks and the changes in stillbirth rate.
Prominent stillbirth researcher Dr. Alexander Hazel led the study that shows birth outcomes improved when moms learned about Count the Kicks.
And I think there was no doubt from the data that we saw a massive jump in the app downloads when there was a TV appearance. And I think ultimately as human beings, we are hardwired to listen to stories. You know, you can hear people like me talk about data all day long, and after a while people's eyes kind of glaze over and you can see that you've lost them. If you combine that with a story from a mum who kind of, as you said, narrated how her experience identifying that her baby wasn't well because it wasn't moving normally, and then someone listened to her, took it seriously, did the tests that were needed, the test showed that there was a problem and the baby needed delivering, then that people listen to that and it touches them somewhere that numbers just don't.
Research shows that in Iowa, when more moms used the Count the Kicks app, more lives were saved.
Count the Kicks has had such an impact in helping mothers believe in themselves and believe in that they know what's happening within their own bodies, and then their ability to talk to a doctor in a way that they'll listen to, that the mom does know what she's talking about, because it gives them the tools to be able to show to the doctor when there's been a change in those kicks.
The Count the Kicks app is a data download for your intuition. Paying attention to your baby's movements is a great way to monitor your baby's health in the 3rd trimester. Download the free Count the Kicks app and get counting today.
Okay, so that's a little bit more about our campaign. And at this time, I'd like to talk to you a little bit about the educational materials that we have in Florida. So our materials are available in English, Spanish, Haitian Creole, and Portuguese. And you can see there's a QR code here. If you'd like to scan that and you want to go take a look at the cart, as I'm giving a little more information. And also, Hybels will put that link in the chat if that's a little bit easier for you to grab. So some of the materials that you'll see when you get into that cart include brochures, traditional and at a glance. That is our health literacy picture-based focused material. So you can order either style. We also have posters. We have a promotional poster that's kind of meant for the front of doors, and then a how-to poster that can be put in patient rooms and explains a little bit more in very succinct language about what the Count the Kicks program is and how to do that. So all of our materials have that Count the Kicks QR code on them. So it's supposed to be really easy for people to scan the code, and that will take them to the app. So at this time, we'd like to give you an opportunity to get into that cart. Once you place an order for materials, we'd love for you to place that order today. You're also free to look around a little bit about additional materials that we have, such as our printable kick counting chart. So I'm going to go ahead and play some music here and give you an opportunity to go in and place an order. And we will be giving away an Amazon gift card for orders that are placed today. So take that opportunity.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back.
All right. So hopefully you've all had a chance to get in there and look at that cart. Something that you'll notice about our materials is the bright, colorful style that we have. It sets our campaign apart. It's very family friendly. The bright colors draw attention. And so that's kind of a trademark of our campaign. People easily recognize Count the Kicks. And so having these up in your office easily draws that attention to what the program is. So let's get into a little bit more. We talked about the research, some of the things that come out of the research, the evidence behind our campaign. What are the benefits to fetal movement monitoring? So keeping in mind, and we'll talk about the app coming up here shortly in a section, but keeping in mind that we want individuals, expectant parents, to count every day with every pregnancy at the same time. We're wanting them to do those three things to really maximize what they understand and know about their baby through this fetal movement monitoring process. And so as researchers have looked at this campaign, one thing that they noticed, and you can see the highlights here on the slide, is there really is not an increase in anxiety among expectant parents. In fact, you see quite the opposite. As they're building that relationship with baby, as they're getting to know their baby through movement, that it really provides the knowledge that their baby is moving, and they get to bond with that experience. Something else that we have talked about with home visitors, people who work with just the extended family unit, is this is really something that can be done as a family group. So if someone has a preschooler or young children, and while they're expecting, they could read a book during their fetal movement monitoring time, and the child can say, hey, I felt the baby move, and that could be a part of the fetal movement monitoring. So again, we're trying to, or we see evidence of increasing that bonding through the family experience. And then additional benefits that we've seen through research study is the reduction of preterm birth rate. We can identify fetal growth restrictions earlier, and women who have stillbirth are at substantially higher risk for severe maternal morbidity than women who have live births, and that's regardless of the cause of fetal death. So there's a lot of really important research around maternal fetal movement monitoring, and we know not only can we have an impact on the baby, but we can have an impact on the expectant parent as well. So implementation. So what does this look like? Now that we've talked about some of the evidence, you've seen some of the materials, but what might this look like in your practice? So again, speaking to patients that you come in contact with about why movement is really important. A question that we get asked often is, so when should this expectant parent start to do the movement monitoring? And we take a look at the ACOG guidelines that recommend that fetal movement monitoring begin at 28 weeks gestation or 26 weeks if someone is considered high risk or they're pregnant with multiples. So we know at that point that probably the expectant parent is able to recognize established movement, and they can track that. So what counts as movement is probably the second question we get asked about fetal movement monitoring. And we say everything that is a voluntary movement. So the rolls, the kicks, the jabs, we say to not count hiccups because those are involuntary movements. And one of the things that we know about fetal movement monitoring is that if a baby is not feeling well, they're not going to track the movement in the same way. There's likely to be some changes within the fetal movement monitoring pattern. And to kind of help put some, to make that a little more realistic for you, if you've had COVID, if you've had influenza, or if you've ever been sick, one of the things about being sick is that your body shuts down and conserves that energy. And so for me, I had COVID last fall, and all I wanted to do was either lay in bed or sit on the couch. I didn't want to get up. I didn't want to move around. When I was prodded to let a dog out or, go get a drink or something like that, I did it, but it wasn't comfortable. I just didn't react in the same way. And so this is the same pattern for fetal movement. If a baby is uncomfortable, they're not going to move in the same way. And so that's another reason why when we talk about myths that we say, we don't want to see intervention happening to get baby to move. We want to see that normal pattern. So that's a really important difference and distinction. So one of the opportunities that we have to track that movement, if you're taking these measurements and you're paying attention to that, how are you keeping track of it? Well, we have a tool called the Count the Kicks app. And this app is available on all platforms. And we've recently worked on updating our languages. So it says here 16 languages, and we will have 20 languages on this app here at the beginning of the year. And so we're really excited for the diversity that we can provide through languages and opportunities to use the resources in someone's native language. When you're using the app, so really quick way, most of you, this is a little bit of a review, but as you can see here on the left screen, once somebody starts their kick counting session, so remember the same time every day with every pregnancy. So if I start my kick counting at 12:15, I'm going to open up the app, and then every time I feel a movement, I'm going to tap that footprint graph that you see here on the screen. And that will start to count. Once it gets to 10, the timer will stop, and then you will be prompted, the user would be prompted to go into what you see here on the second screen, which is what was the strength of the session. So we're not only monitoring how many movements are being captured within a certain time span, but what the strength of that movement is. And that's a really important distinction. So something that you can remind patients to do is, again, with this, and I harp on it every day, the same time, every day with every pregnancy, is help them identify a way to choose the time of day that works the best for them, whether it's when they're at home, maybe on a lunch break, maybe they're relaxing after dinner, but to choose the time of day that works the best for them. And that's a really important part of our app features, is that as they go in, they'll see this longitudinal perspective. If they're a registered user, which is again something you as a provider can remind people to do, is go in as a registered user. And the reason for that is we want to see a longitudinal perspective. If someone is not a registered user, they're only going to see a few days versus seeing an entire trimester of pregnancy. That's a really different distinction when someone talks to a provider about what they're experiencing as fetal movement. Another way that you can, as a provider, be a part of this and help with fetal movement monitoring is just ask them when they come in for their appointments. You can say, how's fetal movement monitoring going? And you're asking them that question, you're asking them to give feedback, and you can have a discussion with them about things that aren't working. So that's a little bit more about the app. And integration. So integrating this into your system. You've got the materials, you know what the app is. Hopefully all of you have downloaded that onto your phone. You can play around with that. It really is simple to use. But you might have a better understanding if you play with it yourself about how to troubleshoot things that patients might ask questions about. So now that you've got that, how do you integrate this into your system? Well, a lot of you are here today as a part of a team. So make sure that everybody else that you work with knows about Count the Kicks. Make sure that they know what the material purpose is. They know about the app. They have the material. They know where to get the materials if they see patients and patients ask questions. Familiarize them with the resources. Another thing that you can do is to include this into paperwork within your system. And so if you have an electronic health record system, we have a couple options for you. We have some templates and experience with hospitals here in Iowa who have integrated this into their after visit summaries. And so there are ways to include Count the Kicks messaging within the paperwork. But one of the most important things is just that conversation during the third trimester, that touch point that you're having with them. And that goes into this third point here, is discussing it with your parents, with the expectant parents at every meeting that you're having with them, especially in that third trimester. But even when they come to you early on in the pregnancy, you can talk to them about what fetal movement monitoring will look like during the third trimester of their pregnancy. So just having that discussion, pointing to those materials, asking if they've downloaded the app, that's a really important touch point, and a way that you can do this at every parent meeting. And then finally, share throughout the community. So many times providers, nurses are invited to community events, task force. They might be tabling at baby showers within the community. They might be providing messaging to the media. Share this throughout the community. Make sure that this is a part of your practice, is that you're speaking about fetal movement monitoring and letting everyone know just how important this is in the third trimester. Again, you are an integral part of us getting this messaging out and working with expectant parents. So again, in line with our focus around our practices, is just we want to increase the opportunities for individuals to hear messaging, to understand messaging, and to be able to ask questions. And so these are a few ways that you can improve the conversation within your practice about fetal movement monitoring. And one of the very first steps you can take is listen and learn. So as you're asking questions, make sure that they're open-ended questions, so that you can learn about the way that your expectant parents are, what they're learning about fetal movement monitoring is, how they're understanding that practice, and how it fits into their life. So instead of a yes/no question like, have you downloaded the app? That's a yes or no question. But tell me about using the Count the Kicks app. Tell me about that experience you've had tracking fetal movement monitoring. If you're asking open-ended questions, that will improve the opportunity to communicate about Count the Kicks and fetal movement monitoring. Being clear and concise. It's really tempting to go off on the medical jargon language sometimes, as we get stuck in communicating the diagnosis and intervention. We get stuck kind of in that medical jargon, but just make sure that you are using terms that simplify that message for everyone. It's everyone that needs to be clear about what importance fetal movement monitoring plays in their pregnancy. Being honest, sometimes we get kind of questions about, how do I discuss this with my patients? And I don't want to frighten them. And, there's a lot of, if we say it might happen kind of belief, or just entering into that unknown space. The reality is that stillbirth is happening, and we want stillbirth to be talked about just as much as the Back to Sleep campaign, which is another one, a very similar maternal child health initiative. For us, we want to make sure they're being talked about in the same way, that we talk about preventative practices. Fetal movement monitoring should be the same as Back to Sleep, just being that line that we say, are you doing fetal movement monitoring? And expecting everyone on the team to talk about fetal movement monitoring as much as they talk about Back to Sleep. So just being honest. And if people ask questions about stillbirth, provide those resources to them. And the reteach, this is just a final stop. When a patient leaves, when you exit a conversation, just ask them, do you have questions? Was there something I said today that might have been confusing, or we probably shared a lot with you today? Is there anything that I can touch on that will help you understand this appointment better? That's another example of a reteach technique that might be helpful in these conversations. All right, so I'm trying to keep my eye on the chat to see if there's any questions. Again, feel free to put those questions into the chat, and Hybels is paying attention and will notify me if I don't catch it. So feel free to interact with us in that way though. All right, so let's go over, I'm just gonna take the opportunity to talk about misconceptions here. One that we have heard quite often actually is, I can just use a Doppler device to monitor my baby's well-being. And this is false, because there's a really good, and I can't believe I didn't put it in here. Sorry about that. We just recently were given permission to use a clip from a social media influencer that addressed Doppler device monitoring. And her point was to expectant parents, when you monitor at home, what you're seeing is an incomplete picture. The Doppler may not be picking up baby, maybe picking up you. You don't notice these differences, but also when we put that together with a contraction monitor, that's a completely different picture. When we see how baby is responding to contractions and we know that we're picking up the different heart rate, that's a completely different picture. We can identify stress in baby earlier. And so we do not want to encourage people to use Doppler devices to monitor baby's well-being. So this is something you can help us fight back on. We have a talking document that I will share in our post, in the email that I sent out with the slides and the recording of this presentation. There are several other misconceptions that are addressed there, but feel free to reach out to us if you run into questions and you're not quite sure how to answer that. Feel free to email me or anyone else at Count the Kicks and ask us those questions so that we can provide some talking points for you. So this is an example of an after visit summary paperwork from one of our medical centers here in Iowa that they incorporated. And as you can see here, it is kind of small, but as you can see, there's a QR code and there's some questions, guidelines for people to ask as the patients are leaving. These are some guideline questions that can be asked for that after visit summary, and they just go over those steps. And again, this is a sample of what we have. We're happy to collaborate with you. If you want to try something like this, we have this example, we have a few other examples, but we're also very happy to collaborate. Another option that we have, last fall, we developed a phone message for another state that just is a 10-second clip about fetal movement monitoring and Count the Kicks, downloading that app, and it just plays as people are waiting for their provider to answer the call or to be on hold. So as we get in here to the end, let's talk about some resources, some things we've talked about throughout the presentation, and I just want to make you aware of. So we just have a limited amount of time together to talk about research, but if you're really interested and you want to get into the weeds on the research and the evidence, I encourage you to scan this code, this QR code, and take this continuing ed training. And who doesn't like CEUs? So we can provide you with CEUs for completing this training. It's completely asynchronous, so something you can do on your own time. You don't have to worry about starting and stopping it. This is an opportunity to help you learn a little bit more about fetal movement monitoring. And again, I just want to encourage you to order materials today. This is the most important part. This is the ask from this webinar, is that we get these materials in the hands of expectant parents. So make sure you take a look at all the offerings. There's some really great things in the Florida store. We have pens, we have badge buddies and badge reels that you can order. We have magnets. So there's a lot of opportunities for people to have different materials that talk about fetal movement monitoring. And I see we have a question in the chat. So if you could give me 1 second, I will switch gears here. So let me come and answer this question. It says, how long should it take for a baby to reach 10 kicks on an average? So what I'll say to that is that this is going to depend on the baby. So an outmoded, it used to be when I was in nursing school way back in the late 90s, we said 10 kicks in 2 hours, and still there's some that kind of perpetuates. It should be in 2 hours, but really this is why we do fetal movement monitoring. We establish a norm for each baby because each baby is unique. Each baby is an individual, and so their pattern is going to depend on what they do and what their environment, their response to environmental stimuli is. So this is why fetal movement monitoring over a time period is so important, because it's not necessarily about that time length or getting 10 and 2. It's more about what is normal and thinking about the strength of movement as well with that. So I hope I answered that question. If not, feel free to follow up in the chat so I can clarify anything I need to. This is a picture of our at-a-glance materials, and just wanted you to see what these materials look like. They are picture-based, a little more friendly on the eyes. As far as text, sometimes I gloss over, as Dr. Hiesel says, sometimes I gloss over with a lot of text, but these are very simple. They are condensed with pictures. And again, in the state of Florida, we have these materials available in English, Spanish, Portuguese, and Haitian Creole. So I'd love to take this opportunity, as we're going out, to introduce another resource to you, our Count the Kicks ambassador. So I'm just going to bump slides here real quick and show you. This is Jennifer McKinnis. She's our Count the Kicks ambassador. And what is it that Jen does for us? Well, Jen is a highly trained volunteer. She's an advocate. She is a lost mom, and she wants to make sure the message is out across the state of Florida. She's very involved in helping us identify resources, in helping communicate. She presents at conferences. She's kind of our boots on the ground. So our founder, Emily, I see Emily was here with us today, is from Florida. And so sometimes Emily gets an opportunity to do the work in her home state, but Jen is in the home state as well. And so she is available if you have opportunities that we can't attend. If you want somebody to come and give a presentation to a group, and it might be in person, Jen might be an option for you. So if you need to get in touch with our ambassadors, please reach out and let us know. But just know sometimes our Count the Kicks ambassadors, they're extensions of the work that we do, and we really appreciate all that they offer to us. So I want to go out with this story here. And as I'm queuing that up, I see another question in the chat. Do I have a presentation for community members, partners can use? Would you, Hybels, can you put my email in the chat so that I can talk with you? I'd love to talk with you about what that looks like, because we can definitely do that. So I'll queue up. This is a baby safe story from an expectant
She
parent.
came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously. Like, it's your baby's life.
I appreciate Dina sharing her story. That's a huge part of the work that we do, is just being able to share these stories about the baby saves. We have a brand new Florida baby save that the story has just gone out there, Victoria. And so I invite you to look at our website, Count the Kicks, and look under our story and baby saves. You can read more about these two baby saves that we've had just recently. It's a really important part of our work, is just being able to put a face with why we do what we do, and know that these families are complete today. So at this time, I just want to open it up in the chat to address any questions. And thank you so much for your time. We'll be sending out the slides and a recording of this presentation, along with several other resources. And again, thank you for your time. We know it's very valuable. We try and condense a lot of information in this short session. So really want to thank you today. Feel free to interact with us. Again, I'll put it on the screen here. Our social media is super active. So if that's just a small way you want to interact with us and you want to repost things for your patients, this would be great. And we have a newsletter opportunity too. So at this time, I will stop recording. And if there are any questions, I'm happy to stick around here for a minute and answer them.